I'm Jonathan Steele. I'm a GP in Gloucestershire, have been for 25 years, and I'm a partner within GDOC, the county-wide federation.
Hi, my name's Simon Brake. I am the Chief Executive of Coventry and Rugby GP Alliance, which is our local federation. I'm also Director of Primary Care for the CCG.
Hello, I'm Peter Wilczynski. I'm Chair of Lakeside Healthcare, which is the large super practice in the north of Northamptonshire.
So I'm Stephen Short. I'm a GP in Rushcliffe, and I'm one of the leaders of the new Rushcliffe limited liability partnership called Partners Health.
So, colleague GPs from Coventry and Rugby over the last 3 years really saw the need to ensure that the GPs could work together in order to protect the future of primary care and ensure that it was able to adequately deliver good, safe, effective services for the population of Coventry and Rugby.
Formed many years ago in response to the requirement to scale up out of hours services.
Yeah, a number of local practices adjacent to us in a building just a few hundred metres away were struggling to recruit doctors and nurses. They had partners who were about to retire, and it made eminent sense for us to merge with them and work with them.
So the prime motivators to start this were actually to address issues of professionalism and quality of the workday.
Well, the usual really, which is getting a quite disparate and broad group of people to agree about shared aims and objectives, and then really to kind of agree the governance and the support structures for doing that, agree the clinical projects that we were going to focus on, and agree the way we were going to distribute the resource then that was available.
Challenge is always getting the practices to recognise the benefit and to be prepared to pay the risk for getting that benefit.
The challenge that we faced to date has been how we integrate other organisations into the culture of Lakeside Healthcare, into the way in which we work, and at the same time enable them to have a degree of site-specific autonomy.
I think the biggest achievement is actually securing the confidence of colleagues and securing the confidence of colleagues to participate in this new venture.
So the achievements probably focus around the delivery of clinical services for the whole area that weren't previously there. So we have a GP and ED, an extended hours GP service running 7 days, and a frailty pathway scheme. Secondly is around shared records, which is quite a big deal for us in Coventry. And then finally was making an organisation. So we were starting from scratch really. So making things start from new, building a governance framework, working out how to employ people and relate to NHS England, putting our commissioning agreements in place with CCG colleagues, and making a kind of a sustainable future for the service and for primary care.
To get to be one of the biggest practices in the country, to have a clear idea of where you want to be in about 3 to 5 years' time, to be able to articulate that vision to our partners, our staff, our patients and the public, and as importantly to commissioners both locally and nationally.
It was always fantastic achievement simply to get the practices working together out of general practice to provide the out-of-hours service. That was a great achievement, and then building on that now, the fact that we've got these Choice Plus appointments, as we call them, across the county, delivered out of the community hospitals or practices on a rota basis. So patients who need to be seen on the same day basis, but the practice workload is such that they can't fit them in, can be seen in these extra clinics. So it's been a great achievement to establish the network of those clinics.
In the last 3 to 5 years, there's been a significant expansion with us merging with a practice in Kettering, and in the very near future merging with practices in Arundel and Stamford. And that will be the start of a process that enables us to move to a large general practice-owned provider of primary healthcare services in the broader geography of the Central Midlands, with a plan to build to a size of 300,000 over the next 2 to 3 years, and then hopefully nationally over the next 3 to 5 years.
Okay, the ambition over the next year is to lead on the development of our new care model, and that is a population health-based care model. It's a model which is both upstream and out of hospital in its orientation.
I think it's more exciting about what we might do over the next 5 years, because there's a real ambition for general practice to join forces with our community services, mental health services, and indeed get specialists in the mix, so we can scale ourselves to become a comprehensive community delivered service.
Over the next 5 years, I would expect us to consolidate our position in relation to other organisations and to have a sustained, properly funded service which allows all GPs and their services to be properly represented across Coventry and Rugby, delivering good, safe and effective clinical services to our population whilst protecting primary care as we know it.
Leadership. Without leadership, you stay where you are, you don't develop, you don't progress.
So I think the key skill is around clinical leadership. So this is to support our leading GPs in order to deliver that vision for them and their colleagues.
Okay, so certainly there's a huge organisational development agenda here, and there's also a need for new and different skills in transformation and also some new transactional skills required also.
So there's all the back office skills, finance, IT, business intelligence. Beyond that, it's the softer skills, the leadership. It is a huge task to persuade practices to come on board when they can't see an immediate benefits. So we need to have a leadership cadre who've got good reputation, good facilitation skills, and practices who can bring